Hello and welcome. We are so excited to bring back Mr. Faisal Nawaz, our sixth year medical student. Welcome, Faisal.
Nice to be here, Dr. Kashyap. Thank you for having me.
Absolutely. Well, our audience already know you through the publications, a previous video we recorded with you. But for the new audience, can you just quickly introduce yourself, Faisal?
Yeah, for sure. So my name is Faisal Nawaz, and I am a final year medical student based in Dubai. And I also like to spend time in research around social media and how it connects with healthcare. So that's also been something very close to me. And hopefully we'll be able to cover some of these points in this interview.
Absolutely, Faisal. From your interview from last year, what we learned, your social media journey, how, and you gave some really good tips for the audience who have not watched that video. It's a must watch. In fact, the video says must watch. So please go ahead and watch it. Today, we want to, we learned from you that how you utilize the social media to your advantage, how you started, how you made a balance, and what is importance for medical students, international medical graduates, or in general for healthcare providers. But today we are very excited to share, talk to you and learn from you about how you have utilized social media for research, the clinical medical research or research in per se, finding, mentoring. So we want to hear from you about it. Tell us how you've utilized social media to build your research experience and then do the great things you have done so far.
Right. Thank you. That's a great question, and just as exciting to even talk about it, because if you would have asked me this question 2 years ago, I would have no idea about the potential that social media can have as a research tool. And I mean, not as just a tool that has some people talking on it, but a proper research tool that gives you everything that a research study can, including a well-written publication. As a medical student and a soon to graduate doctor, it was important to explore different ways of connecting with people, but also creating collaborations that are both international and those that can make an impact using research. And that's where I connected with a very interesting group of researchers who were working towards using the data on social media. And the idea of data and how it can be used to explore topics, that's I think where I'd like to sort of bring in this call and hopefully enrich your audience with more information.
Absolutely. You published quite a bit, Faisal. So walk us through with few of those highlighted publications, what you looked into, how you started as a team and you worked in the team and how you end up getting published or getting to the point where you are right now.
For sure. So with social media in healthcare research, one of the first communities or people I connected with had to do with a platform called the Digital Health and Patient Safety Platform. And you're more than welcome to check it out. They're on Twitter and LinkedIn as well. And what they've been doing is really creating topics that can use the data on social media and analyze that data to create research projects that are published in various journals. So for example, one paper that we worked on was at the beginning of the COVID pandemic, with lots of uncertainty and a lack of data around something like vaccine hesitancy. What we did was created Twitter polls, and using the idea of Twitter polls and mass promotion, we tried to understand how does the public perceive the idea of vaccines during this challenging time. And we've come up with a great number of votes, which are all contributing to data. So about 6,000 people voted on this Twitter poll, and those 6,000 responses are what helped us write a paper that was eventually published in the Journal of Medical Internet Research, which is one of the highly published and highly cited journals in this field. So that is one great example that comes to my mind, especially at the beginning of the pandemic.
Fantastic. That's such a powerful example of how utilizing it. So kudos and congratulations for your work in that space, and congratulations for actually getting it published there as a peer-reviewed publication. Tell us and other works. Please highlight your other works, what you're working in social media. I know that you've been part of panels, you've been part of social media conferences within your institution. partnering with the world famous institutions as well. And then you were one of the social media ambassadors for a Society of Healthcare Medicine annual conference. So share all that, how you get about it.
Right, for sure. And there's a lot to unpack here. So just, I think, building on to the idea of a project and research and publications through it, another thing that I think not many people understand enough to see its potential is the power of hashtags. And especially for a platform like Twitter, hashtags are an amazing way to sort of track data and really see how trends can impact the public's perception about key healthcare topics. So one of the things that I had found it, and this was in my early days trying to understand social media as a medical student, was to bridge together two key areas of health sciences. And one was my interest with artificial intelligence and the medical community. So what this led to was really combining these two into one hashtag, and the hashtag was called MedTwitterAI. And what I did was really create conversations, discussions on Twitter platform that make sure to use these hashtags between our conversations. And what we created was this loop of conversation, awareness, insights, sharing key papers of research on artificial intelligence in medicine. And that on its own created a community solely built on the idea of this hashtag. Once this hashtag was on a level that was impacting more than one community, more than one country, this is where I realized that perhaps even looking into analyzing the impact of this hashtag and how a certain hashtag around any topic, maybe there's a topic that you're passionate about, be it medical education, be it simulation, creating a hashtag around it can be a good source of analyzing the data. And currently, this is one of the projects that we're working on and hopefully publishing soon, which is how artificial intelligence in medicine has become a key topic of discussion and awareness in the healthcare field.
Fantastic, two great examples. One, utilizing the Twitter's powers, the tools, as well. And then second one is your hashtag project. Any other project you want to share?
So other than that, I think one area of really, and this doesn't have to be a project on its own, but as you mentioned, the role of a social media ambassador, I think this is an excellent way for students, IMGs, to really engage ourselves with some really large scale events happening out there in the healthcare field. And those could mean in the form of conferences, in the form of engaging with researchers. And one of the things I've tried to do over these years is where I connect with societies that are organizing events. And by using my follower base that is mostly circled around healthcare and research, I try to promote their event and hopefully also learn something by attending events like these, especially in the COVID era where most of the conferences that I see would be virtual. It is much easier to even connect and become a social media ambassador, live tweeting the conference updates and creating even more awareness and knowledge using social media.
Fantastic, fantastic. So using Twitter polls to get it published, using hashtag in Twitter to get it published, and now connection with the societies. So I see how the pattern is building in as for anybody like yourself, international medical graduates, or other healthcare providers anywhere in the world could get benefited. Very quickly, I know that you're involved in an AI project for creating a checklist. I know it's not published yet, but whatever you can tell without spilling the beans about that project also, and how you get to meet the team, I think our audience will be interested.
Yeah, for sure. And this is probably going to be the first time that this very ambitious project is being talked about. So I'm really happy to share that as part of your YouTube channel. What we did was something that started just as an idea about 1 to 2 years back, which was really seeing how there is this whole buzz around artificial intelligence, medicine. There's a lot more research papers coming around about this topic in the form of application of this technology, but very little guidance or sort of a protocol approach is there for people to utilize. And for someone who is in the healthcare field, I could see that as a challenge where the healthcare professionals working on AI research don't have enough AI-based knowledge to work on research projects. And then you have AI professionals or AI scientists who are looking to dive into healthcare projects who may not have sufficient knowledge in healthcare. And this led to a gap in understanding how research surrounding AI in medicine can be done. And this gap is where the idea of a checklist, where a structure, a template that is built on a consensus can be established using an expert panel of people involved in AI in healthcare around the world. And this is, I think, one of the projects that is very close to my heart, because the impact of this project, where we are helping create a structure, a template for really the next 50, 100, 200 AI papers to come out in healthcare, get to use and actually standardize and promote the field of research. It's phenomenal, the potential of this. How did social media come into this? I think that's the more exciting question here. And this is where sort of connecting with people who've already been a part of the social media network, that's been only possible because these experts were on social media. That also includes you and collaborating with people in your network. And that's the beauty of, I think, using social media. I may have an idea that we share, and then we bring our networks together to create an even bigger force for promotion of research in this field.
Absolutely. And then this is so pleasing to know that this major project is led by two medical students from two different continents with the same passion for AI in medicine. And then people came together to help them out. So this is such a fascinating story. Look forward to get the final results and then see something in print in coming months, Faisal. Well, this was fantastic. Can you quickly summarize any 3 pointers as a take-home message for our listeners today? What can take out as a key point from your journey in clinical research or research utilizing social media?
Right, yes. My 3 key messages would be to change your perspective of social media. This is more than an app. This is more than a way to pass time. This is a tool on its own. We are in an age where social media can be used for research through hashtag analysis, through Twitter polls analysis, by being part of engaging events, conferences, and really putting ourselves out there as we become the future healthcare leaders that also use evidence-based research, be it in any form or place.
Fantastic. Thank you so much, Faisal, for your time. Viewers, please write in comment section what you want, what you liked about this video. Subscribe to our channel, hit the bell icon so then you can get alert anytime we upload these videos. We upload them on a regular basis. We just let us know. Once again, thank you so much, Faisal.
Thank you.